we're not seeing the number of mosquitoes come down as rapidly as we would have liked. That could be because they're resistant to the insecticides being used, or that they're still standing water that they're breeding in, or that simply it's a really tough mosquito to control. It breeds indoors and out. The eggs can hatch in a bottle cap full of water. So that's something that we'll be determining over the coming days and weeks as we intensify the efforts there now to stop the mosquito population from growing. Zika can only spread when a mosquito bites someone who's infected. Then about a week later, that mosquito becomes infectious and bites other people. So it doesn't get into the mosquito population the way West Nile virus does, for example, where it can stay in there for years and spread and travel between birds and mosquitoes. It's a very urban mosquito and an urban disease, Zika is. And therefore, what we're looking at is this particular neighborhood, this 1 mile radius north of downtown Miami, where there has been spread of Zika. We've identified, the Florida Health Department has identified 12 infections in this small 500 square foot area, and they've identified a buffer zone around there where we advise pregnant women not to travel, and if people live within that area, to take every step to prevent mosquito bites, particularly if they're pregnant. Testing mosquitoes for resistance to pesticides is not simple. It requires ideally growing them up from eggs, which takes a week or so, and then testing them by a standard method. You can also catch them and do preliminary testing, although that may not be accurate, but even that will take a week or so. So we don't yet know, and that's a reflection of the fact that in this country we really dismantled the mosquito monitoring and control infrastructure over the past few decades. So we have blind spots where we don't know where the mosquito populations are and what the susceptibility is to different insecticides, and that makes it much more difficult to control them. But what they continue to do is to investigate all cases of Zika to see if they might be locally acquired, if so, if it might have been through a mosquito. We look at the data every single day to see if there should be new recommendations based on new data. But there's a more important message here, which is for pregnant women who live anywhere where there are Aedes aegypti mosquitoes present, important to protect yourself against mosquito bites, because it is possible that there is rare spread of this virus. 4 out of 5 people don't have symptoms. So when there is spread in an area, you might not know it. That's why it's so important to do everything you can. Use DEET on exposed skin, wear long sleeves if possible, and to the extent practical, stay indoors in air-conditioned or screened space.